He was 10 days old and perfectly healthy baby boy, nothing wrong. He ate like a champ, and all of a sudden we put him down for a nap and he woke up screaming, turning blue. So we rushed him to the emergency room.
When you hear your child needs CPR to be alive, then I think you've hit the lowest you can hit.
When he went to Geisinger, he was found to have bouts of supraventricular tachycardia, which is a very fast heart rate, as high as 300 at times. And they tried all of the typical maneuvers to try to break the heart rate and bring it down with medications, trying to overdrive pace him and shock him. And that's when we were given a phone call from Geisinger to see if we could help with the situation. By 11:30, with an hour of us getting on ground at Geisinger, we had baby Dietrich on ECMO, which is basically a modified form of heart and lung bypass. So it's just a machine that's going to do the work of the heart and lungs of the patient until we can figure out what the problem is and try to fix it. And within about 3 minutes of being on ECMO, his heart rate converted back to a normal sinus rhythm. Packed him up in the helicopter. The transport was uneventful.
Transport ECMO service allows us to extend our reach beyond the walls of the hospital to people who live even hours away. It's really an extraordinary program. It's one of the few in the country that provides ECMO transport services over this distance.
At that time, you can't really think, you don't know how to think, and as a parent, you kind of yourself have to be taken care of. They know exactly what to say to you and when to say it and how to keep you just in control and to be there for your kid.
Once we were able to, take the load and the pressure off his heart and let the ECMO machine do the work for his heart rate had normalized, so he no longer was having that dangerous high heart rate. And within a couple of days, his heart function recovered to normal.
Within the last 3 years, Nemours has developed a ECMO transport program that collaborates and coordinates care not only with our partners in the community, also with centers throughout the Delaware Valley and in the tri-state area whose patients require advanced support that they're unable to provide on site.
Time is of the essence in anything like this. There were multiple factors in our favor that allowed us to save this child. One was having the existing relationship that we have with Geisinger and them knowing that they can call us when they have a situation like this, that we can potentially rescue a patient. And the other is preparation. When we were expanding our ECMO program and expanding our ECMO services, we invested a lot of time, effort, and energy into how we were going to provide ECMO transports and off-site cannulation. So I think it was a combination of those things that allowed us to effectively deploy the plan when we needed to.
I would think that, maybe sometimes you don't always have a choice, because of where you are and a circumstance that's happening. But if you have a choice, this is the best place to bring them. Everybody we spoke to, from admissions to even the people at Ronald McDonald House, all the way across the board, just spectacular.
They're like heroes in themselves.
Yeah,
they
they're
work very,
superheroes
very hard.
to us. There's no doubt.